Hi, it's Arin from SimplyDoc again. Just want to share with you what we've seen this week in telehealth during the COVID-19 pandemic. It's a beautiful morning here in Virginia. It's Friday, April 3rd, 2020 as I'm recording this, and spring is here outside, which helps to make it through these tough days, makes those days feel a little bit better. And of course, I want to first off say thanks to all the medical professionals out there working with patients directly and fighting this pandemic every day, putting themselves at risk. I'm really grateful to you, and we at SimplyDoc are here to help you however we can. So a lot of the news right now is about hospitals that either are already or will be over capacity as we reach the peak of the pandemic in different parts of here in the US and globally. And so knowing that of how swamped the hospitals are makes it extra tough to hear too how many other medical practices outside of hospitals are struggling right now just to keep their doors open. I've seen articles this week about medical practices having to shut down, lay off workers because they're unable to see patients. They don't have the financial ability to keep their practices running. And it kind of brings home that, it's easy to forget sometimes that medical practices are a business too. And so whether it's a family medicine, optometrist, dentists, mental health counselors, we're not used to providing care to our patients remotely, and it's tough to do that if you can't pay your office rent or pay your team's salaries. So, I think that's an area where telehealth can definitely help. So the more that you can push your visits to be online for non-emergency situations, it's better for your patient's health, keeping them out of the waiting room. And also better for you as a business, frankly, being able to keep your own doors open and being able to keep, some form of revenue and payments going in your practice. I think that, one good thing that we're seeing as a temporary measure is HIPAA regulations being relaxed during this time period a bit, or at least enforcement's not being taken on. And that's probably should be a temporary thing, but hopefully a longer term thing is that also reimbursements around telehealth are being permitted in more cases, and so we're all becoming more open to the idea as a society, as payers in healthcare, that telehealth visits should be paid for. So that's great for the current situation we're in. I think those reimbursement changes will stay for the longer term. But right now, still, the focus for a lot of healthcare professionals is how they can get any telehealth solution out there that they can start to use right now. It doesn't have to be the perfect long-term solution for them, just something that they can get started on. So this kind of first wave of telehealth that we're seeing in these early weeks or months of the pandemic are sometimes using tools that were not previously approved for telehealth, business conferencing tools like Zoom and such, and that's fine as a short-term solution. But I think the other thing, talking about medical practices being a business too, that means we also need to think about the economic forecasts. And the economic forecasts I'm hearing obviously are not good. Even when this pandemic ends and the restrictions around it and the quarantining ends, which hopefully will be in the next couple of months, the longer term economic issues are going to remain. So I suspect, and plenty of people economically more smart than I am are saying, we're going to be in a deep recession for at least the second and third quarters of 2020. So all of us have to be creative in how we serve our clients, how we serve our patients, because we have to remember too, they're going to stay nervous, even if the restrictions are lifted at some point and we return to some sort of new normal. It's not going to be the same normal that we had before, and patients justifiably, understandably, are going to stay nervous about in-person visits when they can avoid them, which means cancellations and such for medical practices, even after the pandemic passes. So one thing we've done in this last week is we've officially launched our single license version of SimplyDoc, which is really targeted towards solo practitioners. Most of our work at SimplyDoc has been targeted towards clinics and custom workflows for them and custom branding. But this single license version is really targeted towards those solo practitioners or very small clinics that previously were not thinking about telehealth at all, now realize they have to do something. Maybe they're getting started with a business tool out there, but that's just a temporary solution for them. So this version, it's at mysimplydoc.com, or you can get to it from our regular site at simplydoc.com. Allows you to get us set up very quickly. Just text a link out to your patient to get them in a call with you right away. So great way to deal with somebody who needed to cancel their visit today because they didn't want to come in person, but maybe you can still visit with them remotely, and the mysimplydoc.com version of our platform is very easy to use, free for 30 days, $50 a month after that. So really targeted towards those solo practitioners to help them be able to recapture some of the care that they can provide to their patients in a remote setting with no downloads or any other friction between the care provider and the patient. And then for the larger groups that we're working with, medical clinics and hospital systems, a lot of the focus right now remains on let's get out a first version very quickly, but they're also taking longer term view of let's get something out quickly, but what can we then work on? What improvements can we make to that? Feature changes, workflow changes can we make in the coming months to have something that addresses their longer term uses of telehealth? Because I think one thing that we can probably all agree on in healthcare is that telehealth in some form is here to stay after the pandemic. It's quickly becoming an more accepted form of healthcare, as it should be. And so even after the pandemic passes, the forward-looking clinics that we're talking with are thinking about how are they going to conduct healthcare past the restrictions through the rest of this recession, through any fears of a recurrence of quarantine, a recurrence of the coronavirus, and after initial restrictions are lifted, and just accommodating this changed mindset that we have in general societally from this. So a lot of the conversations that we've been having this week are about that, getting something out quickly and then looking ahead to further integrating SimplyDoc into other parts of their system, which we can do through API calls. Our technical team can work with larger medical groups who have a technical team and hospital systems to help integrate SimplyDoc more tightly into their experience. And we've also talked with a number of potential partners who already work with other technical solutions to medical groups, and are now looking at how can they add on telehealth and video visits to what they offer to their clients, to medical clinics. So we're talking with a number of them as well about integrating the video visit portion of SimplyDoc into the platforms that they already offer to those medical groups. So, we've all got to be creative in these times for sure, in how we provide care to our patients, how we as service providers can help you as healthcare professionals to provide that care to your patients. So in some ways, I think, just as a society, as individuals, we're getting through the initial shock of this pandemic and adjusting to a life under quarantine. Telehealth is also, passing through an initial rush of just getting out any tool out there to be able to meet with patients remotely. And as we get through that initial rush, things will start to turn to a little more forward-looking of the medium term, the long term, the rest of this year and beyond, of, what was my first telehealth solution just in that first month of the pandemic, and then now what do I need, which may or may not be the same thing, to get me through this new future of providing healthcare. So we're certainly interested to have those calls with you. Just contact us at simplydoc.com. Happy to set up a conversation. And again, most importantly, to all of you on the front lines of the coronavirus pandemic, thank you for the work that you're doing to provide care to those who really need it right now. So stay safe out there, everyone. And for everyone else, stay home.